This is the Prime Edition. Welcome back. Reproductive health stakeholders are calling for the removal of an age limit for persons seeking reproductive health services in a bid to increase access to the services, especially among teenagers. The proposal has already begun to spark debate with the Ministry of Health officials instead of advocating for greater sensitization of the youth on the need to delay their sexual debut. Nancy Okware with the details of the proposal that is likely to reignite the conversation on reproductive health among teenagers.
Teenage pregnancies in Kenya remain a major concern, with 15% of girls aged between 15 to 19 years reported to have conceived. According to reproductive health actors, sexually transmitted infections, HIV and gender-based violence remain a major challenge owing to limited access to reproductive health services for teens.
We have adolescents who are adults, who are 18 and 19 years old, who can be able to consent for adolescent health services. But we also have adolescents who are minors, who, according to the law, are considered children. And what the law says is that for any child to access any form of health services, which includes reproductive health services, they have to get consent from the parent.
To this end, the stakeholders are calling for a review of existing policies to accommodate the needs of the society.
Legislators, policymakers, and community members are able to reach a consensus on what could be the most progressive laws as far as age of consent to reproductive health care is concerned. Legislators are beginning the conversation to ensure that they are able to put in place laws that protect minors, but at the same time ensure universal access to health care, including reproductive health. Protect service providers, especially healthcare providers, so that when they offer service, they are not caught up in legal battles with parents.
Child health reproductive players in the Ministry of Health, on the other hand, are calling on parents, teachers and other stakeholders to play an active role in advocating for abstinence as a better strategy.
To help the parents have teachable moments with their children, to try and delay sexual debut as long as possible so that the adolescents and the children can attain the highest standard of education and opportunities for them to have better lives.
We need to work with Ministry of Education so that also they can also create awareness at the school level. What will happen if you engage in sex? If you delay, you'll stay in school. If you stay in school, you'll be more successful.
With these challenges mirroring across the region, a campaign dubbed Access to Reproductive Health to Adolescents has been ongoing since 2020, targeting Kenya, Uganda, Zimbabwe, Zambia and Malawi. Nancy Okware, Prime Edition.